Hi, I'm Dr. Adam Petty with Carolina Chiropractic. Today I have the pleasure of interviewing one of my dear friends that I went to grad school with, and his name is Dr. Chris Cueto. He practices in New York City. He contracted COVID back in March and has survived it and is now donating his plasma. Today he's going to tell us about his story of what he went through, what it felt like, and at the end he's going to talk about the experience of donating it. So, Chris, if you don't mind, uh, tell us a little bit about what you went through.
Hi, Dr. Petty. Thanks again for having me here. So I know that one of the things that you and a lot of people have been asking is what I've gone through. As a COVID survivor and surviving through this virus is kind of like a day-to-day account. It took me 2 weeks, 14 days. So I'm going to try to be as brief and succinct as I can with regards to what I suffered. First and foremost, it it's a sickness that actually spreads along over time. It doesn't just get you right away. Typically, it starts off very gradual and it really tries to wear you down. So, for 14 days, I've had a fever ranging anywhere between 99.6 to 102.8 or 103. The first day was mild. I just felt a fever. At first, I thought maybe it was anxiety. First thing in the morning is I didn't really feel so well. I felt a little lightheaded, a little nauseous. Didn't get much sleep. I just felt pretty amped up. I felt that my heartbeat was actually going pretty fast, and I could have also chalked it up to some anxiety. My wife even said that it could be my anxiety too. But later on in the day, I checked my temperature again. It came to 101, and I realized, okay, this is it. I may have this. So I isolated myself from my family, got myself into one of the rooms, got all the things I needed, my laptops, everything, just to stay away from everyone, which was already tough as it was. And it gradually got worse. By the fifth day, I've had body aches all over, headaches, sinus pressure, pain behind my eye, coughing, shortness of breath, weakness, even some GI issues as well. I didn't have a sore throat though, but I also had really severe night sweats. I felt like middle of the night. I felt like I just took a shower. A couple of times I had to change out of my clothes just to get a good night's sleep. It was just so soaking wet, and it gradually progressed. One of the biggest things was the fear of it was, will it get worse? Will it get especially during the nighttime? By the 10th day, it was getting better. Now, mind you, when I was going through this, there was a lot of unknown and a lot of uncertainty about this sickness with this virus, especially around March. I do have a lot of friends who work the front lines, including my wife, but a lot of my friends too who really work closely with them. I was asked them, like, what do they typically see? And usually it's the same thing. It doesn't hit you right away. It's nothing like a cold or a flu at all. Absolutely not. It's nothing like that at all. People do die from this pretty fast, and people get it quickly. Sometimes you could spread it to people. Actually, a lot of times you could spread it to people you didn't even know you had it for about 2 weeks until they get it and you get it. So that's what's scary about it. And again, asking them what they've seen. Usually by the first day, it kind of starts off gradual, and then fifth day it usually gets worse. Usually by the 10th day, that could either be where it gets really escalates to be one of the worst things you'd feel. You might have to get hospitalized, or it gets better. So for me, the 10th day, thankfully, was starting to get a little better. But definitely still a lot of weakness. I did a lot of my breathing techniques. If I could move around, but most of the time, I was pretty weak. There were days where I really couldn't move. I couldn't even open my eyes. It was pretty bad. 14th day, that's when I could say it was a lot, I definitely felt a lot better. My fever had started to calm down.
So we opened this up to social media to ask what questions you guys wanted to know, and one of the questions that kept coming up on different media platforms, as well as in our office, was what tests did they run on you, Chris?
Hey Adam, that was a really great question. What tests did they run on me? So during the time when I got sick, I called up my doctor, my own primary care physician, And him and just like anybody else, during this time, this is around mid to late March, they didn't have any testing kits available. So they just told me to go straight to the urgent care. So around the fourth, or actually the fifth day when I was getting bad, I did go to the urgent care. They examined me, tested me for the flu, and I was negative. The doctor did listen to my lungs. It wasn't as bad yet. I was starting to wheeze, but he didn't pick it up on it though. Obviously got my temperature. My heart rate was pretty high. It was probably, I think it was 99, and my blood pressure was was elevated than usual. It was 130, I believe it was like 132 over 91, which is high for me. He just said to me that you more than likely have it. You have all the symptoms. Your symptoms are a little bit mild though, so you could just go home and continue to isolate like you normally would. I did ask for the test, and he said, no. I'm assuming because at this time or that time, they didn't have enough testing kits available, but he did encourage me to contact the New York State testing services, the drive-through places basically, and see if I could get an appointment to get tested, because that's now starting to get available at that time. So I did contact the state, answered a few questions. Questions, I believe, things like, am I a healthcare worker, for example, which I am. I'm a chiropractor just like you. Was I exposed to anybody who may have had COVID? At that time, I didn't know, so no. But a lot of the other things too, I think I've already forgot already, but pretty much qualified for the test. So they said it'll contact me in 3 to 5 days. To this day, I haven't gotten a call. So at that point, as my symptoms really started to progress and I was getting a lot weaker, there really wasn't any point. I already had assumed that this is what I have. Listening to anecdotal symptoms from people, the news, from my friends who are working the front lines, and there's a lot of them who work the front lines, including my wife. She's a nurse also, a critical care nurse, working the front lines, working with COVID patients. These are the symptoms that was presented. So those were the tests that was available at that time. Didn't get tested. And honestly, that's the case for a lot of folks who had quote unquote mild symptoms. And mind you, mild symptoms is basically, it's not, again, like the flu where you could just isolate yourself, get some chicken soup, relax. No, it's a lot worse than that. We're talking about fear, not breathing, having all these tough symptoms, fever. Those who are not mild were the ones who were getting hospitalized, and that's where it could escalate, and that's where it gets even scarier.
So the follow-up question, again on social media and everything else, and on all of our minds, is: did you test positive for the antibodies or the blood draw, or and what was that like? And how long did it take you to get it? Because let's be honest, you got it. New York City got hit before any of the other places really hard, and with a shortage of tests, I'm sure was a little bit difficult as well.
Yeah, Adam, that's definitely a great question. When I went to donate, finally, and mind you, it took me 3 weeks to after 3 weeks of me symptom-free, for me to finally qualify to get tested and donate. They did do the COVID test on me finally. They also did the antibody test. So just kind of give you, anybody who still doesn't really understand what the COVID test typically is, it's a nasopharyngeal swab where they get this huge Q-tip and they really stick it all the way up your nose. It's not really comfortable, not painful, but just not comfortable. It lasts for several seconds, and then they take it out and they put it in a culture swab to be tested by the CDC. And in terms of the antibody test, they do a typical draw blood. Typical things that you usually get that you might be familiar with when you go to your normal physical. But in terms of my COVID test, it came back negative. They actually told me 2 days later, which was quick, but now the testing, we're talking about now mid to late April. So they're getting through all the tests fairly quickly now. And as for my antibody test, I got my results 4 days later, which was actually pretty quick too. Thankfully, I have antibodies. Kind of getting into that too. with the antibodies, there's a lot of different methodologies, I guess. Again, I'm not a lab technician. There's so many different things. Even talking to other healthcare providers, they really don't have a clue. But kind of give you an idea. Mine was based on a scale of 1 ratio to 80 titrations. 80 titrations is basically how much they have to dilute the antibodies as it's exposed to a viral culture of the COVID-19 virus. And basically if you have positive, good high number of antibodies, if it had to take 80 dilutions for it to finally disappear. So that's 1 ratio to 80. I had 65,536. Which is a lot. Knowing and hearing from other folks there who donated theirs was like around 2,000, 4,000. I had 65,000. I don't know what it means necessarily, but there's a good possibility it meant that I was exposed to a high viral load at one point, and my body responded. It produced all these antibodies right away. Thankfully, that's what I have, and hence why a lot of places where they like to donate definitely would love me to come back and donate again, which I am planning to. I donated once, which we'll talk about in a second, but it's a great experience, but definitely would like to do it again.
So another popular question was, it seems how you have the antibodies. Do you still wear a mask in public? I think we had talked earlier, and you said that New York State law requires you to wear a mask, but not everybody watching this video, especially in North Carolina, it's not required. But even if it wasn't required, would you still wear a mask?
Yes. In terms of masks, let me just grab one right now. Obviously, these are one of the masks I've been wearing. So even if I did test negative for COVID, and I did test positive for antibodies, theoretically, those who have antibodies should theoretically have immunity to it too, which I believe you should. There's still a lot of uncertainty right now with this virus. So just for the sake of safety for myself and anybody else, I do wear a mask. Okay, I may not be wearing an N95. Those N95 masks are really reserved for those really working the hospitals, the front lines, nurses, doctors in the emergency room, ICUs, directly taking care of all the COVID patients. But I do wear a regular mask, such as that. Why? Well, it's not just a law, or it's not really what they're asking. They're really suggesting, but I think it's just common courtesy for everybody else. I think that when I'm wearing this mask in front of anybody else, it just means that I care about you. I respect you. I don't want to expose you with any of my virus, nor should I want from you. You don't know what I went through. You don't know anything about me. You didn't know that I actually had COVID, and neither do I know from anybody else. So I think it just makes it a lot easier. It also gives us a reminder that, hey, we still need to take some sort of precautions amongst each other right now. We're not out of the woods at this point. We're not. It looks like we're not even anywhere close to it. So for me, I wear this out in public. A lot of times I may pull it down if I'm with my family, we're walking down the neighborhood. But if we do come close to anybody else, just like I see anybody else walking by us, we all put our mask in just because, hey, common courtesy. You know what? We don't know. We just want to make sure that everybody else is around us is safe, especially around where I am. Where I'm in Long Island, I go work in this. I have an office in the city. People really need to take a lot of precautions, and that's what we do.
I think the favorite question on media in everyone's mind was, where do you think you came in contact with the virus, that you could have caught it? Or do you think that being in New York City, you had a higher likelihood of catching it? Be it the way that you go to work, the environment, the weather, whatever you may think. All right.
Well, that's a great question that I've been asking myself. Where did I get the virus? Well, I don't know. It could be anywhere. I'd like to think that I didn't get it from my office, from any of my patients or staff. Thankfully, as I hear report from my own staff, from my own patients, I don't hear any reports of it too. So, and we did take a lot of precautions, including myself. I was already wearing a mask, screening patients, especially with their temperatures, disinfecting every single equipment and table that they're on. So I have highly doubt that I got it from any of my patients. But I also commute from Long Island to the city, and it can get very densely populated. It can get packed. Who knows? Someone could have been breathing, coughing, sneezing not too far from me, and those droplets I picked up. I could have touched a surface, let's say a pole or a seat from someone who was infected maybe hours ago, and I contracted that way. I walked through Penn Station in New York City and I contracted that way. It could have been from anywhere like the groceries, the drugstore, the barber, who knows. And the problem about that too is, again, the incubation period could be anywhere from 2 days, 5 days to 14 days. So at that point, 2 weeks gone by, I wouldn't have even recalled where I've gotten it from. And during that time, that's where it's scary, is where during that time you could actually be spreading out to other people. You're shedding the virus without you knowing it, and since you don't have any symptoms. And that was what's scary. And kind of going into it too, it's like that's one of my biggest fear, was that I spread it to my family. So yeah, kind of going back to it too, where did I get it from? I don't know. Hence why common courtesy, wear your mask. If I sneeze, viral, it's not about me picking something up. It's about if I do sneeze or cough, let's say I didn't have the antibodies, at least it will help prevent, it'll establish some sort of barrier from those tiny droplets too. And trying to keep your distance too.
So Chris, another popular question is, what meds did you take? Did they give you anything, as well as like, what were you taking on your own?
To be honest with you, I didn't, unlike anything else like the flu, where they give you a Tamiflu or a cold medicine if you have a cold, there really wasn't any meds that they could even recommend. I had to take Tylenol because at that time we were hearing the news that aspirin, Advil, Advil, and the NSAIDs would possibly exacerbate your symptoms. So just precautionary sake, for if the fever was really getting bad, for a fever reducer, I would take Tylenol. But that's the extent of it. Tylenol or Coricidin. Coricidin is a cough medication which is good for preventing raising any high blood pressure. But it also has 600 milligrams of acetaminophen, which is Tylenol. So during the days as it progressed where it got worse, when I was coughing a lot, especially in the evenings, and my fever was starting to spike up. Mind you, a fever is also very important. That's why I'd rather not take any meds, because a fever is your body's natural way of defending yourself against these infections and these invaders, killing off these viruses. But nonetheless, when it was starting to spike up and I was really starting to feel bad, I would take the Coricidin already to help control my coughing and the fever. If my lungs felt tight, if I was starting to wheeze, thankfully I still have a prescription medication of albuterol, which is an inhaler. I had childhood asthma. I never had asthma since I was a child, so I haven't taken an inhaler in close to 20 years. This is the first time I actually had to take an inhaler. Thankfully, I updated myself, but every time I get a checkup, but this time I had to actually use it. I probably had to use it about 4 or 5 times, and it's usually in the middle of the night when the symptoms get worse. So in terms of medication, Tylenol, Coricidin for coughing and fever reduction, as well as the inhaler is what I used. Everything else, I drank a lot of fluids. I went through, especially the first few days, I must have drank 5 pitchers of water or more. No matter how much I drank, I just felt relentlessly thirsty. I was losing a lot of body fluids throughout this whole time. I lost a lot of weight, lost about 15 pounds, but a lot of water, a lot of rest, tea. I was also taking about 2,000 milligrams of vitamin C, 12,000 IUs of vitamin D, 50 milligrams of zinc, which is known to be a great antiviral, as my supplements to combat this whole thing. I was already in good shape. Have a very good diet. I work out all the time. I think that does help. Exercise, keeping yourself healthy, is a great way to prevent it. And I think that probably helped me out with my case, because I think it could have gotten worse. And I also have a good, strong vitamin regimen, and I continued with that. I even upped the doses of vitamin C and vitamin D because of this. So that's what I was taking. There is no known medication for COVID-19, so it's really all the doctors could say is just drink a lot of fluids and rest, and nothing else. I just knew all these other things on my own.
So the question is, how long after you came in contact, which I realize you don't know when you came in contact with it in your situation, did you start to show symptoms? And like, do you remember the day that it started?
Like I said, I don't know how long ago I contracted it. Again, it could have been 14 days of exposure. It could have been 5 days of exposure to somebody. But all I remember is when I started to take a good log of my symptoms, March 26th will always be March 26, 2020 was always a day that always will be an importance for me now, because I knew that that's when I started getting symptoms. I woke up with, again, night sweats, couldn't really sleep, had a light fever at that time, and I just felt uneasy, and I just felt nauseous or lightheaded towards the latter part of the day. So again, it could have been 5 days, it could have been 14 days, who knows? And that's what's scary.
Do you think PPEs work? And is there any specific ones that you would suggest for people to use?
Wow, yes. What they're seeing right now, and even talking to my friends, even my wife's coworkers too. Unfortunately, my wife also had contracted COVID-19, so she was out of commission from work too for a while. But she still maintains close contact with her own coworkers. And my friends who are in the ER and ICU, intubating patients, they all have PPEs, the protective gear. And surprisingly enough, you would think that they would get some sort of exposure. So when they are telling me, and we could even see these from our state reports from the governor, and everyone, regardless from the governor, a lot of the healthcare workers on the front line tested negative for antibodies and negative for COVID-19. It is showing that these protective gear do work. It does work. It creates a barrier. Mind you, they're in a tougher situation where they have N95 masks, a surgical mask, a face shield, full attire, full gear, gown and everything to protect them. It just shows us the barriers do work. And if we're going outside of that hospital setting, but maybe in a regular setting, yeah, the mask I think can at least help prevent just spreading it out, or even just at least creating some sort of barrier.
So this is the question I'm getting a lot: is if they come up with a vaccine, would you take it? One, because you have the antibodies, and two, just whether the research is sound enough, or whatever you want to answer on that aspect. But I will say I understand. I would debate it as well, because I don't get the flu vaccine, and I've only ever had the flu once in my life.
Whoa. Yeah, vaccine. I mean, listen, we all want this thing to be done, to be over. And you and I both feel how natural immunity tends to be the best thing. Again, this is not to be in any way debating about vaccines and all. I don't take the flu vaccine just because it really doesn't show a lot of effectiveness. But then again, we've been exposed to many different strains of the influenza virus as it is. So our bodies have known to fight it off in different ways. You could get the flu and had the vaccine, and I don't get the flu, and I didn't get a vaccine, and so forth. This is a brand new virus, a totally brand new disease. That's why even herd immunity right now is not something I don't think it's such a great idea. Maybe in the long run it would be, just because I think at this point, at a point where in the future we've all been somehow exposed to different strains of it, it could work. But right now the herd immunity, and again, I don't want to get into debate here, but you're posing a lot of risk. There's going to be folks who have no symptoms, to some folks who have really bad symptoms like what I did, and some folks who have severe critical symptoms that they die. And I don't want to get into a tangent here, but for myself, being in a center at a place where the virus hit pretty hard, I've known many people already whose relatives have passed away. It was tough. In the month of April, every single day I was offering my condolences, to 1 or 2 condolences every day, which is more than the usual within 5 or 7 years. And it's tough, even going through live streaming virtual funerals is one of the toughest things, and I could barely even imagine what my friends had to go through with that. But kind of going back to this again, will I get the vaccine? That's a tough call. Personally, they shouldn't rush a vaccination right now, just because it could be very dangerous. If they're offering it to people, it's been a few months. I'm just worried about the impact of what it may do. Could it kill? Hopefully, yeah, it'll kill a virus, but could it be dangerous to a human being just because it's rushed? I hope not. That's why I'm a little weary about it. I'm not saying yes, I'm not saying no, but I am a little weary. I am happy. I am that my wife and I, and hopefully my son, we have some sort of immunity to it. But the vaccination itself usually takes 12 to 18 months, and that's usually the earliest, and without any issues. If they're trying to rush it, I am a little bit weary about it. So again, my views on it could change day to day, week by week. Who knows? So as of now, that's my opinion.
So I think everyone's favorite question to ask is, what are your thoughts on reopening? Should we do it, or should we hold off? Should we stage? Should all states open at once or differently? Anyways, what are your thoughts on reopening?
That's a doozy. Reopening. Oh well. You know, again, this virus should never have been politicized, and I am not here to talk about politics or anything else. And it's all about really all of us trying to work together, unify, and try to just make sure no one else dies. One is too many, and we're seeing thousands and thousands of deaths. That's more than September 11th, more than a lot of other times. Should we reopen? Again, being armchair politicians or workers or anything else, I'd say some parts of the country should reopen if they were not fully exposed to it, if they have very low counts of the virus. Just to open up the economy, sure, but also take caution. If they're starting to see, they really should monitor. If they start seeing folks exhibiting symptoms, well, by all means, those folks, they need to be quarantined or isolated for now and get tested just to be sure that they don't have it and they pass it on to anybody else. And it really comes down to each individual too. Can they have ownership and be truthful to themselves, or him or herself, about, hey, I'm getting this, I'm that. You can't be in denial at this point. Do I have this? Oh, let me do what I need to do to protect everybody else around me and protect myself and stay away. That's a tough call to do. Places like New York City and LA, New York City, like where I am, downstate New York, actually. I would love to reopen. I mean, I went through the sickness already too, but I'm also a business owner. I'm seeing a lot of people who lost their businesses already, friends who lost their jobs. Myself, I had to furlough my staff at some point too. Of course, I'd love to see the region open. I'd love to see everything open. I want to see everybody. I want to go to a ball game. I want to see sports. I want to go back to my gym. I want to get a haircut. All these things. We want to have normal life again. But I think that if you're in an area where it's too dangerous, when we were hit pretty hard, you really have to exhibit caution. If you're in areas where it's not really hitting you too hard, then yes, by all means, just take caution. I think that, and again, this is my own opinion. If let's say person A comes from New York and travels to a place like Montana where it's hit very lightly, again, a person like that from LA or downstate New York goes to Montana, places where it's very low, they really either should not go there, not travel, just so if you could help it, and B, if you have to be there, take ownership and really just make sure that you don't have it. Get tested, quarantine. If that state has a way to do that, just so it protects their own citizens in their own state or that region, they should do it. Just to protect them, just to protect everybody else. Again, views, they could change day by day, week by week. Hopefully, we start seeing rates of infection, hospitalizations, and everything start going down. Again, these are all by metrics. It's not the best, but that's what we're going through. It really all depends on that.
I think one part everyone wants to hear about is donating, and that's the hero aspect. In the song Foo Fighters, There Goes My Hero keeps playing every time I see like your face come across my social media feed or anything else. I'm like, that's what everyone that has tested positive for the antibody should be doing. And so we all want to say thank you because you are a hero. And they say giving blood saves lives, but this saves lives too. Oh, and how did you go about donating, and how did you learn where to go, or any of that stuff that could be helpful tips for those that do have the antibodies but are struggling to figure out how to donate as well?
People who recovered, they need antibodies. It took, unlike any other blood donations, which takes about a few minutes, maybe 5-10 minutes, this one would take 40 minutes, just because they do have to draw blood repeatedly and filter out the plasma and then re-inject the red blood cells back into you over and over again. For some people like me, I'd had to really do a lot of grip strength every so often just so they could draw out blood. But other than that, it was actually a great experience. It was really nothing. It was painless. Well, for me, it was painless. Maybe a little uncomfortable as that one small time they place a needle in. But overall, you could kind of see as they explain to you what their technicians explain to you what they're doing. It's actually pretty amazing. It's a great experience, knowing that somehow or other they're using it to save somebody's life. And just recently, they've showed it in the news already. One reporter actually donated plasma, and I believe it was ABC News. You could go ahead and look that up. But it was in California. But this person had a 20% survival rate and ventilators for a long time, gave the plasma almost immediately, started showing signs of improvement already, and he made a full recovery. And that's not just one account. This is what we're hearing over and over again. One of the things too that you should understand though is that even if you've recovered and you want to give plasma, they've also said only a small percentage are able to take. Here's why. If you tested for COVID-19 and you tested for the antibodies, so you have antibodies, they say you have it, but you still tested positive for COVID-19, they still can't take you. You haven't fully recovered. So that's one group gone. If you tested negative for COVID-19, but your antibody titers are less than 80, that's not enough. Again, another group not taken. So could you imagine the amount of people that they put in and only a small percentage are able to donate? This is why it's important now for a lot of people. If they could donate, please. If you don't have any medical conditions, things like thalassemia or anemia, and or any other diseases that prohibits you from donating, donate. It is such a great thing that you can do for somebody who is truly sick, and for their families who have lost their wits end and praying for some miracle. It's a great feeling too. It really is. It feels like you did something. You're helping somebody else, and to me, I feel like it's a small thing that I could do, that I could contribute, while others out there who are working the front lines, from the policemen, the EMTs, the doctors and nurses, even the grocery workers and the delivery people who are risking their lives every single day doing this. For me, it's a small thing that I'm doing compared to what they're doing. So yeah, that's my experience. And so yeah, so the Facebook group, again, it's a non-for-profit organization. It's really more of a grassroots group. It was started by another lady, roughly my age, also from Long Island, who survived it too. It's called Survivor Corps, and you can look it up on Facebook. They have so much information of where and how they could donate. And it started in New York. Now we're talking about the United States, and now it's going globally. So it's a great way for anybody to really connect with anybody. It's also a great support network too, because you're seeing a lot of posts of people who are sick, relatives sick, and need prayers for their relatives who could possibly be dying. It's a great group to go into and get more information.
Hey Chris, I just want to thank you for coming on my channel and wish you luck reopening this week. Good luck with that in New York City. I know that they're allowing you guys to start doing some stuff, and you're doing some soft reopening. And I wish you the best. And if there's anything we can do, just let us know.
Adam, thanks again for having me here. It's great to see you again. It's been years since we've seen each other since chiropractic school during our internship days too. I hope you do well. I'm hoping everybody's okay with you and your family, and hope your community's also doing well too. And just to gain some sort of knowledge from this as much as I can from what I could contribute. If they have anybody else has any questions, and if you have any other additional questions, please don't hesitate to let me know. I'm more than willing to answer as best as I can. Thanks again.